Future UTI Diagnosis. What's next for urinary tract infections? Imagine a future where finding out if you have a urinary tract infection takes just minutes instead of days. That's what new diagnostic tools are aiming for. Currently, urine culture is the main method, but it takes time and can delay treatment. Researchers are working on faster ways to identify infections and resistance patterns. One promising technology is mass spectrometry, specifically liquid chromatography, mass spectrometry. It can analyze urine samples directly and identify bacteria in about 10 to 15 minutes. This means doctors can quickly see what bacteria are causing the infection and decide on the best antibiotic. Future improvements might even detect resistance markers, so treatment can be tailored precisely. Molecular methods are also making big strides. Techniques like polymerase chain reaction, loop-mediated isothermal amplification, and next-generation sequencing can find bacterial DNA and resistance genes. This is especially helpful in complicated or recurring urinary tract infections, or cases where standard cultures don't find the bacteria. But these methods need careful interpretation to avoid overdiagnosing in people without symptoms. Another exciting development is rapid phenotypic susceptibility testing. These tests can tell if bacteria are resistant to antibiotics in about 5 hours. That's a huge step forward because it helps doctors choose effective medicines sooner and reduces the use of broad-spectrum antibiotics that can lead to resistance. Point-of-care testing is also on the horizon. These are quick tests that can be done right at the bedside in less than 20 minutes. They can tell if a person truly has an infection, how many bacteria are present, and what antibiotics might work best. This helps avoid unnecessary treatments for people with bacteria in their urine but no infection symptoms. Multiplex testing is another future trend. It could test for multiple bacteria and sexually transmitted infections like gonorrhea and chlamydia all at once. Plus, it would include antibiotic resistance profiling. This comprehensive approach would help doctors manage infections more effectively and efficiently. From a urologist's perspective, these advances mean more precise diagnosis and faster treatment. They can start targeted therapy sooner, which improves patient outcomes and helps fight antibiotic resistance. But integrating these new tools into everyday practice will need adjustments in workflow, cost considerations, and validation through clinical studies. In the end, the future of urinary tract infection diagnosis is about making testing faster, more accurate, and more informative. This will help doctors treat infections better, reduce unnecessary antibiotics, and keep patients healthier.